All right, good morning. Today's movement practice for you is going to emphasize creating new motions around your spine, hip, knee, and ankles. What I want you to do is start laying down on your stomach. You want to make sure that your chest and head is as close to the ground as possible. So when you make a pillow with your hands, just make sure that your shoulder blades are broad and kind of draping away from your spine. All right, so this is known as a prone position. And we're going to start with about 20 to 30 seconds of belly breathing, okay? So all I want you to do is emphasize the four corners of your stomach as you breathe into them, and then when you breathe out, try to feel your stomach move away from the ground, okay? So again, your inhale is going to expand your stomach within a three-dimensional space, and then on the exhale, you're going to try and move the stomach away from the ground. All right, so you're going to feel like it's expanding and then shrinking. All right, and this is a great opportunity to just kind of like check in with yourself, see how you're feeling. That's about it. All right, so from here, what I want Jenna to do and what I want you at home to do is flip your toes under and get your kneecaps off the floor. Okay, so you're going to feel like your heels are kind of radiating back and you're putting yourself into a toe extension. Okay, so you want to try and get your toes as close to your knees as you can so that your heels are behind your toes. All right, and then from here, I want you to start to pick up your elbows, hands, and forearms. Head stays on the hands. All right, so then you're just up. You're going to keep thinking about broadening those shoulder blades away from the spine. And then do a little bit of a lateral flexion to the left. So you're going to side bend to the left, and then you'll go through the middle, and you're going to side bend to the right. Okay, and just do this a few times. Just noticing how it feels to side bend left and side bend right. Okay, you come to the center, you're going to lower down. All right, keeping your knees off the ground, all I want you to do is pick up your forehead. Your gaze is still down. All right, and then you're just going to laterally flex your head to the left and laterally flex your head to the right. Okay, so if you're at home doing this, what you want to make sure is that you're not rotating your head here. We're strictly looking for a pure side bending of the cervical spine. Okay, and again, you're just trying to bring awareness and attention to how the left feels relative to the right. All right, and after you've done this a couple of times or a few times, you'll stop in the middle, and now you're going to do a cervical rotation. So you're just going to turn your head left and to the right. Okay, kind of like you're looking up and over your shoulder. All right. And then you're going to let your forehead rest on your hands. Bend your knees, and just windshield wiper your legs side to side. So take the feet to the left and to the right a couple of times. Okay, make sure that you're breathing with ease, all right? You don't want any choppy or jarring breaths to be occurring. And then whenever you're ready, flip those toes under, put them down again, knees lift up. Now you're going to pick up your head one last time, and this is going to be an axial rotation of your head. So imagine you have this plumb line or this rod going through the center of your head all the way down through your tailbone, and you're just going to turn your head left and right. And that's it. Okay, and if you want to make it a little bit more challenging, you can try, when you turn your head left, can you see your left elbow with your right eye? And then when you turn your head right, can you see your right elbow with your left eye? Okay, if you can't, that's fine, but that's just going to let us know that you still have some range to improve upon or build and grow into. All right, then you put your forehead down. All right, let's bend those knees. You're going to keep your ankles flexed, and we'll do a couple of those sacral pumps, okay? So you're going to press your knees down, let your pelvis lift up a tiny bit, and then on an exhale, relax it down, okay? So you breathe in, you lift, and you exhale lower. At home, you want to make sure that you're not aggressively like lifting your hips really, really high. That's not the purpose of this. All we want to do is take a little bit of pressure off of the pelvis and lift it into the air. Okay, so if you think about, about an inch is fine. All right, and on that last one, 4th or 5th rep, you're gonna push down, keep your hips up, and you pause. Okay, now you might just hold here. If you want the challenge, and you've seen other videos or you understand the terminology, I want you to add a posterior tilt here. So you're actually going to scoop your tailbone kind of between your legs a little bit. You're going to broaden your sacrum and your low back is going to move closer to the ceiling. All right, so right now the pelvis is lifted. It's a posterior shift of the pelvis, and then we have a posterior tilt of the pelvis, okay? And that should have a decompressive effect on your low back. Now you keep holding here, and then you're going to start to reach your hands back, pick up your arms and head. All right, and this is a hovering cobra. Okay, and you'll see that Jenna has bent elbows. We want to make sure we have a slight bend in the elbows. We're thinking about broadening your shoulder blades away from your spine. Okay, and whatever you do, don't lose the contact, the downward pressure of your knees into the mat. Okay, and then from there, you just make sure you're breathing. Okay, you can find that expansive diaphragm breath. Okay, and if you want something more challenging, you're going to try and maintain the transverse abdominis or the intra-abdominal pressure and breathe more into the chest. But that's a more advanced technique for you to do only if you understand it and have done some of the prerequisite breath correctives to do it. All right, after you feel like you've held this for anywhere from 8 to 12 breaths, you're going to reach your hands forward, okay, all the way forward. You relax your pelvis and then just sway your legs side to side again. Okay, so the idea is to move slow. All we're trying to do is get blood flow kind of going in a specific direction here. All right, and when you're ready, you're going to straighten those legs back again, toes flip under, kneecaps lift up, and then, so your arms are reaching forward this time, and I want you to start to slide them back so your elbows are underneath your armpit. Okay, and you're going to kind of lift yourself up into what's called like a sphinx position. All right, and here we go. So knees are still off the ground. Now, to make sure that you're not aggravating your low back, first of all, you don't want to think about bending backwards. That's not the purpose of this. We want to think about going forwards the whole time. So if you're tractioning your elbows toward your knees and then trying to scoop your tailbone under, it's going to take some of that unnecessary stress off the low back area. Now, we're going to start with a little bit of a protraction and retraction. So you're going to push your rib cage back as your shoulder blades protract away from the spine. And then you're going to slowly start to retract the shoulder blades and the rib cage goes forward. Okay, and you just do this, 2 or 3 times. I want you to just feel the ranges of motion that you can move through. All right, terrific. Then you're going to push back so you feel like your rib cage is lifting. Drag your elbows another 1/2 inch back behind your armpits. And then you're going to push your knees down. And you're going to lift your butt up and back to a knees down forearm plank. All right. Now, if it's too difficult or it feels awkward from that lifting angle, you just bring your knees forward 1 inch or you bring those elbows back 1 inch. Okay, your chin is going to look at your chest. All right, you have a slight posterior tilt, so you're trying to maintain like a relatively flat low back area. All right, and then you don't want your shoulder blades pushing away from the spine too much, but you don't want them collapsing toward the spine. There's kind of a happy medium where the shoulder blades are floating somewhere between protraction and retraction. Okay, and while you're here, you're going to try and traction your elbows toward your knees and your knees toward each other. And then make sure you find your diaphragm breath. Okay, so diaphragm breath is going to be the belly expanding and then kind of melting away. Okay, you do this anywhere from 4 to 8 breaths. Good. You want to make sure your jaw, your cheeks, your teeth, everything in the face is soft. All right, and you're trying to associate good tension in your triceps and armpit muscles. Then Jenna, see if you can soften that space between your shoulder blades a bit, like your mid-spine. There you go, exactly. That feel okay?
Yeah.
Okay, all right. Yeah, and that's another thing. If you're doing this at home, if it doesn't feel okay, don't keep doing it. Try to find a way to make it more comfortable or okay. All right, now from here, Jenna's going to keep her palms planted, straighten her elbows off the ground, and just hold. Okay, so this is more advanced. All right, now she's going to bring her forearms back down. Okay, now I want her to straighten her knees off the floor. Again, a little bit more advanced. When you're in this position, you're really emphasizing keeping your hips high. Yours are good, Jenna. And then pressing your heels back so your quads start to kick on. Okay, and then you're going to lower your knees down. Okay, straighten your arms off the ground again. Great, you hold for another 1 or 2 breaths. Okay, and her inner thighs are working. Okay, so you want to make sure those adductor muscles are turning on. That's going to give you a better connection to your transverse abdominis and some of the other abdominal muscles that we want to wake up here. All right, and when she's ready, she can walk her hands back to her thighs. All right, fantastic. She'll come to a tall kneeling position. All right, and we're going to bring that left leg forward to start. Okay, so here we go. Her back toes are going to flip under. Okay, reach your arms forward. Okay, and we just pause here. Okay, so I want you to straighten your back leg off the ground. Perfect. Okay, so now this is just like a high lunge position. And what we're going to ask Jenna to do and what we're going to ask you to do at home is you're going to pivot your back heel down a full 90 degrees. Okay, so the heel turns down. All right, great. And then you can turn your sternum toward us, bring your hands to your heart. All right, and everybody at home, you're going to be looking for this similar shape. Okay, so you just start here. Now I want you to take your left foot and I want you to pivot it in on the heel. All right, perfect. And now Jenna's going to go into a lateral lunge on the left side. Okay, so she's going to flex into her left hip and left knee. All right, now you can't see this at home just because of the camera angle, but she actually has a posterior tilt of her pelvis. So I want you to make sure that you feel like you're scooping your tail under just a little bit here. All right, you feel that, Jenna? Okay, now she can do a couple reps here just to kind of get used to the position. So she's just doing, again, it's a lateral squat or a lateral lunge. Okay, and again, we can't see because of the angle of the camera, but you want to make sure you're trying to keep your knee back. Your left knee is staying somewhat behind the toes. It'll come forward of the ankle, but not the toes. You're emphasizing how far back can you send your butt. Okay, on the next one, after you've done a few reps, you're going to pause there. Great. And then Jenna, see if you can broaden those shoulder blades away from your spine a bit. Okay, you're going to laterally flex left. Okay, and then you're going to rotate to the right. Okay, and everyone at home, what you're doing is you're side bending left and you're rotating your chest right toward the straight leg. You're going to reach your right arm up to the ceiling and reach your left hand toward your right foot. Okay, and then we're going to do pulses here for about 30 to 60 seconds. So it's like you come up, good. Yep, and then you're just going to reach again. So you keep your left hip, your left knee bent the entire time. And that's it. Okay. Now, if this is too much for you, you don't have to reach for your right foot. Very easily, you can just reach for your right knee. All right, and then the other thing to think about is going to be exhaling when you reach. Okay, because that exhale is going to pull that diaphragm up, encouraging the rib cage to kind of open up, widen, and move away from the pelvis. And this can, again, create that decompressive effect on the spine. Okay, let's just do a couple more. Everything feel okay?
Good.
All right. Something else you can think about is squeezing her right thigh straight. Okay, and this is it. Like, this is a simple motion, but it's a three-dimensional motion. Okay, so we're moving in the sagittal plane, frontal plane, and transverse plane. Hips are going back, she's side bending, and she's rotating. And not only from the rib cage, her pelvis is actually doing the same thing. Okay, and then whenever she's ready, she comes out of it. Okay, you're just going to turn your, turn your upper body to the left. You're going to pivot your foot. Yep, right foot's going to pivot in. You're going to lower the back knee, change legs. All right. So reach your arms forward. Yep, you're going to straighten your back leg off the ground. Okay, and then you're going to pivot your back foot down. Good. And then your front foot forward. Yep. All right. And then from this angle, we're going to start to move to the side just so we can see your low back. But find your right hip, right knee. All right. This actually works better than I imagined. Okay. And then what I want you to do is add that posterior tilt of the pelvis. Okay. So you can see in the video that she's actually emphasizing her low back to stay a little flat right here versus having an excessive like sway to it or a big arch. All right. So on the next one, you just go to the right. Okay. You pause. You want to make sure you're sitting your hips back a fair amount. Okay. And then you're going to side bend your torso to the right and then rotate your torso to the left. Okay. And same exact thing that we did on the other side. As she exhales, she's going to reach her right foot across to her left foot. Okay? And the whole time, she's going to do her best to maintain a strong flexion of her right knee and right hip. Okay? You know, you can count reps here. I prefer to use a timer, or I just do whatever feels good. You know, that's another thing, is do this for as long as it feels okay. Okay, if you feel like you're experiencing any right knee pain while you do this, it might be because you're not sending your hips far back enough. Okay, and the other thing would be to turn your right foot out about 30 degrees. Okay, and these are just different things, kind of depending on the condition of your muscles, where your joints are, and also the state of your spine. It can actually cause a little bit of aggravation. And what I would say to that is maybe just either take the comments I just said about, you know, regressing the motion, or do one of our other videos that's more sagittal plane based and really kind of master the front to back mechanics of the hip, knee, and ankle before adding frontal plane and transverse motion. All right, great. And then after this last one, you're going to slowly start to come up, and then we're going to turn your whole body back to the right. So you're going to that starting position. Okay, great. And then you come to a tabletop when you're ready. Okay, you just pause. All right, and then bring your forearms down to where your middle fingers are. Yep, come back down to this knees down forearm plank position. Okay, we'll spend about a minute associating strong tension. Okay, so again, we're trying to get everything from the armpits to the knees, all the muscles and fascial chains between those areas to turn on. Okay, you take a few breaths. Okay, will you lower your chin more? Just pull, yeah, exactly. Okay, and then whenever you're ready, you can stay here. If you want a little bit more of a challenge, just pick up your knees halfway. All right. Good. Great, and press your knees out a little bit. Good. Then you lower your knees down. You straighten your arms. Good. You hold. Okay. If any of you at home want the full challenge, you would pick your knees up from this position. Good. Press your heels back. Can you get your butt higher? There you go. So this is a more challenging plank variation just to kind of finish off with. You'll feel it more in your pecs than the other ones. Right. Then you're going to lower your knees. Good. And then bring your whole body to the ground. Okay. And you can bend your knees, flex your ankles, push your thighs into the floor, let your butt lift up. All right, find that posterior tilt if you're able to. And then reach your arms back, head comes off the floor, so you come to one more hovering cobra. And if you're able to, try to find that posterior tilt of the pelvis. All right, and then you bring your hands under your forehead, relax the butt, sway your legs side to side. All right, then you can bring your hands under your armpits. Push your knees down, lead with your butt, do a knee push up to child's pose. Just reach, hands in one direction, hips in the other, being sure not to let your hands lazily drag back. And that's it. Quick, not so quick, home movement practice for you to do on your own. Thanks for watching.